Signs and symptoms of Klein-Levin syndrome. Klein-Levin syndrome presents with a distinct pattern of recurrent episodes of hypersomnia, accompanied by cognitive, behavioral, and sometimes psychiatric disturbances. The hallmark symptom is excessive sleepiness, where patients may sleep 18 to 20 hours per day for several days to weeks during an episode. This profound hypersomnia is linked to dysfunction of the posterior hypothalamus, a region responsible for promoting wakefulness through histaminergic and orexin-producing neurons. When activity in this region is reduced, the brain cannot maintain arousal, leading to prolonged sleep. Along with hypersomnia, many patients experience hyperphagia or compulsive overeating. This is due to dysfunction of the lateral hypothalamus, which regulates hunger and satiety signals. During episodes, patients may show a lack of appetite control and consume large amounts of food, often preferring sweets or carbohydrate-heavy items. Another common symptom is derealization, a feeling of being disconnected from reality, and confusion or slowed thinking, often described as brain fog. These cognitive symptoms are believed to stem from hypoperfusion of the thalamus and frontotemporal regions, which are involved in sensory integration, consciousness, and executive functioning. The thalamus acts as a relay center for sensory and motor signals, and when its function is impaired, patients may feel disoriented and emotionally detached. The prefrontal cortex, responsible for planning, attention, and social behavior, also shows reduced activity during episodes, which explains why patients appear apathetic, sluggish, or emotionally flat. Some patients may exhibit hypersexuality, aggression, or childlike behavior, which reflects the frontal lobe dysfunction, specifically in the orbitofrontal cortex, which is an area involved in impulse control and socially appropriate behavior. Mood changes are also frequent during episodes. Patients may appear depressed, irritable, anxious, or even paranoid. These psychiatric-like symptoms are believed to be due to temporary disruptions in serotonergic and dopaminergic pathways, which are closely tied to mood regulation and reward processing. Importantly, patients typically return to their baseline level of functioning between episodes, with no memory of what occurred, which is consistent with functional rather than structural damage. The sudden cyclic nature of KLS symptoms support the idea that the disorder is related to episodic dysregulation of the brain's arousal and behavioral centers rather than progressive neurodegeneration.